Hi, I am Dr. Somasekhar Rao, Gastroenterologist and Hepatologist, Yashoda Hospitals, High-Tech City. Today we will talk about fatty liver. Basically, what is fatty liver? Fatty liver is deposition of extra fat on your liver. And why are we worried about fatty liver? See, at least 50% of urban population today has fatty liver. And fatty liver is a cause of chronic liver disease over a period of time. And fatty liver should be taken seriously because at an early stage, if it is diagnosed, it is always reversible. And fatty liver can progress to chronic liver disease and it can cause cirrhosis of liver. All of us know, or at least many of us know, that alcohol is a cause for cirrhosis of liver in many patients. But all of us should also know that just non-alcoholic fatty liver disease can cause cirrhosis of liver, and it is a reversible problem, and awareness about this problem plays a very important role. And when you come to know fatty liver, what are the causes of fatty liver? Most important cause for fatty liver today is abdominal obesity, and when we take worldwide, it will be obesity all over. But specifically in India, we see most of the patients who have fatty liver will be having only abdominal obesity. The fat is deposited around the abdomen only. Generalized obesity may not be there because most of the time in India we see abdominal obesity. How do you decide someone has abdominal obesity? It's very simple. The circumference around the belly button, if it is more than 100 in males and if it is more than 90 in females, can be diagnosed as abdominal obesity. So any patients with abdominal obesity will definitely have fatty liver. Other causes: uncontrolled diabetes for prolonged period of time can cause fatty liver disease. So these are the most important causes, and most of the urban population today in India have fatty liver disease. We are seeing this fatty liver even in childhood. So childhood obesity is increasing, along with that childhood fatty liver is also increasing. So what are the treatment options for fatty liver disease? So most important here is, as on today, there is no medication to reverse non-alcoholic fatty liver disease. There are multiple medications which are being investigated. More than 50 medications are being investigated for treatment of fatty liver disease. But as of now, most important thing here for treatment of fatty liver disease is lifestyle modification, which includes exercise and dietary modification. And importance here is diet. What is the diet which you have to take to reverse this fatty liver disease or avoid getting a fatty liver? Most important thing is avoiding excessive sugars and excessive carbohydrate meals, balanced protein and balanced fat. These are the most important things which we have to work on to avoid getting fatty liver or to reverse the existing fatty liver disease. Carbonated beverages like all your cool drinks and all those things should be completely avoided, and excess fatty foods like cheeseburgers and all these westernized foods or eating outside should be completely avoided. Quantity of rice or roti, whatever you have, should be limited. The quantity of vegetables and fruits should be increased. This is the basic diet which we have to follow. Amount of protein should be adequate. Amount of protein can be in the form of egg, paneer, non-vegetarian like chicken and fish. All these things should be included, and excessive oil should be avoided. These are the most important things which you have to follow in your diet. And exercising at least for 45 minutes to 1 hour in a day, and this can be brisk walking, jogging, cycling or swimming. These are the simple things which anyone can follow, and you have to see that you do these exercises at least 45 minutes to 1 hour in a day, at least for 5 days in a week. All these things together, this lifestyle modification will definitely help you avoid getting fatty liver. Even if you have fatty liver, this can be reversed back to normal within a range of 3 to 6 months. Thank you.